Hello everyone. Today's video is about fluoroquinolone toxicity and how you could approach your healthcare provider to talk about fluoroquinolone toxicity. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So I posted a video about 9 months ago about fluoroquinolone toxicity Q&A, and then somebody posted a comment on that video about 5 days ago about just asking how they could contact my office if they want to work with me, which was lovely. Always flattering for folks to ask that. And then I've just noticed, like, oh my gosh, there were several comments that were made on that video that I did not see. One of them was 8 months ago, and the question was, how do we approach our doctor on this concern? How do we get them to look at the damage that was caused by this? So anyways, I sent an apologetic reply there saying, sorry that I missed this, and I just missed it. So I figured, well, better late than never, and I thought, well, this is an important topic. I thought I had something some advice to give around that. So here we go. So better late than never, and yeah, always do my best to get to the comments as quickly as I can. But sometimes there's a lot of them, and sometimes they fall between the cracks. So I just keep on doing my best. So fluoroquinolone toxicity, just for those of you who don't know what that is, you're like, I wonder if that's something that applies to me, or why should we care about this? Some people go on these antibiotics that are called fluoroquinolones, drugs like ciprofloxacin, levofloxacin, moxifloxacin, and a lot of people go on those drugs and they have no problems at all, but some people get really, really sick. These fluoroquinolone antibiotics, they can be very, very toxic to the mitochondria. When they get into the mitochondria, it's very hard to get rid of them, to detoxify them from the mitochondria, and they can just cause some people to have devastating health issues, unfortunately. It can cause a lot of fatigue, brain fog, like anything that's associated with mitochondria not working well, cause a lot of damage to tendons and other connective tissues as well, and leave people in a lot of pain and just really, quite frankly, like badly disabled. So it can be really, really awful. Some people have less extreme forms of fluoroquinolone toxicity, but sometimes it's really, really awful. And for those who are not aware, the turn of phrase that is used kind of more colloquially, shall we say, in these fluoroquinolone toxicity circles is it's called being floxed. So anyways, little fluoroquinolone toxicity 101 there. So now that we're all up to speed, so if I was a person who had fluoroquinolone toxicity and I wasn't a healthcare provider and didn't have treatment options to help myself, I would when it came to kind of approaching my healthcare provider about that, I guess the first thing that I would ask myself is, do I think my healthcare provider can help me? Because not every healthcare provider is necessarily going to have the tools that are going to help with resolution of fluoroquinolone toxicity. So subtext is that, say I'm thinking about when, I was a young man, in high school, I had a family doctor, and I feel like if I had fluoroquinolone toxicity back then, I don't know that my family doctor would have been able to help me a whole heck of a lot, because my family doc probably had never heard of fluoroquinolone toxicity, and there are pharmaceutical drugs that can be helpful for symptom mitigation and things like that, and potentially with helping to get kind of at root cause related things, with helping to recover from fluoroquinolone toxicity, but it's not really a direct treatment method. And so just thinking back to my old family doctor, I think those are all the tools that he had in his tool bag. So I don't really know that he could have helped me a whole lot. So I don't know that I would have spent a whole lot of time and effort trying to figure out how to approach him, to have that conversation, if he might not really be able to help a whole heck of a lot. So I guess that would be the first question of, like, is the healthcare provider able to help? If the healthcare provider in question knows about supplements and diet and maybe other interventions like different IV therapies and things like that, like ozone therapy and whatnot, then yeah, it'd be worthwhile to have that conversation. But it would just, again, be a question of whether talking to X, Y, or Z healthcare provider would actually be helpful or not. But if that healthcare provider in question is a functional medicine doctor, whether that's an MD or a DO, or it's a naturopathic doctor, and not every functional medicine doctor or naturopathic doctor is familiar with fluoroquinolone toxicity, or it could be an acupuncturist, it could be a really savvy holistic nutritionist. Like they're lots of different, could be a chiropractor, like folks who know about nutrition, supplements, that type of thing, and then of course importantly would know about fluoroquinolone toxicity, could the clinician in question that could potentially help you could, have one of many designations that are out there, as long as they have the right knowledge base. So usually the best option would be, just first saying like, have you heard of fluoroquinolone toxicity before? And if the answer is, deer in the headlights, then the answer is probably no, and that they might not be the most helpful. Or if they say, yes, I have heard of that, then okay, have you treated it? And if the answer is yes, then that's great. If the answer is no, but I'm familiar with it, and I feel like we can maybe work with this together, that might be the best you're going to find in your area, because unfortunately, the overall awareness of fluoroquinolone toxicity, to my understanding, is quite low. And then even if you're aware of it, it doesn't mean that you necessarily want to treat it as a clinician, because it can be quite daunting to get into, to be perfectly frank. But then also, like, maybe someone's heard of it and they're willing to try to help you, but maybe they don't have any experience with it. So it's always nice to find someone who's treated folks who have been floxed, but if you can't find someone like that, at least if they know about it, know about the treatment principles, then that would be the next best thing. The next best thing beyond that is if your clinician's like, I have no idea what that is, but you have a good rapport with them, they're your functional MD or DO or naturopathic doctor or acupuncturist, whoever it is, like, hey, I trust this person, I like them, we have a good rapport. Even if they have not heard of fluoroquinolone toxicity, maybe they can learn more about it. Or if you're on a message board or something like that, and you've heard about how like supporting the mitochondria can be helpful, ozone therapy can be helpful, ramping up detoxification pathways, treating comorbidities of things like chronic infections and mold toxicity and MCAS and whatnot can be helpful, then an open-minded clinician, even if they're not familiar with it, they can learn. You can kind of help them learn, and that would be maybe the third best option. So when it comes to broaching the topic, outside of just leading with, hey, do you know about fluoroquinolone toxicity? If they say yes or no, or maybe so, then I think what would be really useful, and definitely what's useful for me, is if you've kind of been able to map out the timeline for how this all came to be. Because when patients come in to see me, and oftentimes they don't have fluoroquinolone toxicity on their radar, but if a patient said to me, like, my health was pretty darn good, and then I had this urinary tract infection, and I went on an antibiotic, and everything just went to heck in a handbasket from there, well, then I'd be thinking, well, which antibiotic was it? Was it a fluoroquinolone? If the answer is yes, then that's definitely going to put that high up on the differential diagnosis list, that they might have been floxed. So that kind of timeline is really important. I've had other patients before where it wasn't, they didn't come in with that obvious history, but we're like just kind of struggling with their case, like what's going on. We start thinking like, well, maybe it's something less common. Thankfully, fluoroquinolone toxicity is not a super common thing compared to like mold toxicity, for example, or SIBO or other things that are much more common. But I've had patients where it's like, well, when did your symptoms start? What happened around that time? Oh yeah, actually I did have a fluoroquinolone. Like I remember the one patient, we she sleuthed back through like maybe 10 years of medical history or something, and found like, oh yeah, I did take a fluoroquinolone drug, within a couple of months of my symptoms starting. It's like, well, maybe that's it. So I think putting together a timeline, it's like, hey, I had X, Y, or my health was really good, or I had X, Y, or Z, mild symptoms. I had some allergies, I had the occasional headache, but I was pretty healthy. And then I went on this fluoroquinolone, and then I developed all these symptoms. I think just presenting that information and saying like, this is, very fairly clear-cut timeline, that would be really compelling evidence to bring to that conversation. And then outside of that, unfortunately, I don't know of, really 100%. What's the word I'm looking for here? I don't think there's like a one-stop shop resource to say like, oh, bring this website to your to that appointment to say, hey, like here's a group of clinicians or whatever who talk about this. So like, just as if someone wanted to broach the topic of like, I think I might have chronic Lyme disease, bringing, say, the ILADS website, the International Lyme and Associated Diseases Society website would be useful. Or I think I have mold toxicity, bring, maybe a link to or send them a link to the ICI, like the International Society for Environmentally Acquired Illness, because they talk a lot about mold toxicity and have training courses and that and whatnot. For getting floxed, I mean, there are some, useful Facebook groups, and there's I think a blog, I can't remember the guy's name now, unfortunately, but anyways, I don't think that there's like quite a one-stop shop resource. So anyways, I hope this information was useful. If anybody has any questions or comments on this topic, please feel free to post in the comment section below, and I will leave it there for now.